Okay, yeah. So when I was in school in law school in San Francisco, I was always broke, and I sometimes never knew where my next meal was coming from. One night I had nothing to eat for dinner except cheese and crackers. That was it. And I was working 5 part-time jobs at the time. I was working for the registrar's office. I was clerking for legal aid. I was doing everything I could to make a buck, but tuition and rent, used up all my funds, and sometimes I just didn't have money for food and all that. So a couple of days after my cheese and crackers dinner, I was walking to school, and I went through this shortcut through this office building just to take, and I noticed that there was a big buffet luncheon there. Okay, I think it was being hosted by one of the tenants in the building, and I remember looking at all the good food on that buffet table. There's salads and cold cuts and oh man, all kinds of good things, steamed trays full of things I couldn't even imagine, and thinking how nice it would be to have a really good meal while I was in law school. And what did I do? Well, you can guess it. I went and stood in line, and I got myself a really nice lunch. It was probably one of the best meals I had in the time I was in law school. And I was scared the whole time. I was afraid that somebody was going to come and yank me out of line and throw me out in the street, but only after working me over for a couple of hours, But you know what? Nothing happened. Nobody said a word. And I think they probably thought that maybe I belonged there, or they thought I was a nut and they were afraid to say anything and set me off or whatever. They didn't. Nobody said a word. I just went through, had myself a nice meal, and left. You know how after the first time you do something, the next time you do it, it's easier? It wasn't. It never got easier. Every time I did it, I was scared to death that they were going to, work me over. But I did, perfect my routine. After a while, I got myself one of those little "my name is" name tags. I put that thing on, and I'd go through the line, and I'd be telling people, say, it's been a long time since we've seen each other. Of course, they wouldn't know who I was. They wouldn't have a clue. But they'd say, oh, yeah, good to see you again. The one time, there was a host actually standing there at the start of the food tables and was shaking everybody's hands. I went through, and I thanked him for inviting me, and he says, oh, yeah, happy to have you here, So I figured they didn't have a clue who anybody was. It was a good thing. So you can imagine what my next clue is hint is for making it through these tough economic times, okay? The next time you see a buffet table, go and help yourself, even if you haven't invited. And if you're smart, you'll do like I do. I always take a Ziploc so that I can get some food and take it home to my family. In fact, I brought my Ziploc today, and if there's anything left back there, I'm gonna fill it up, Dina, because I knew you were putting on a really nice spread today.
I think you should.
Yeah. And by the way, I want to tell you, I do a lot of these seminars, and this is a nice breakfast spread that Dina put on today. I've seen much worse. Okay. Okay. So let's look at the compliance update and guidance. Adult child coverage to age 26. One of the basic questions on this requirement is, we all know that you have to cover a child to age 26 now in your plans, regardless of any criteria other than their age and the relationship to the employee. So marital status, tax dependency status, residency, student dependent status, anything like that, none of that applies anymore. There was that exception carved out where if a child had access to coverage through their own employer, you could exclude them from the plan, but that's going away too. So we have every child to age 26, which to me is kind of insanity, because it's saying that even if your child's married and they have their own job and they have health coverage through their own job, you still have to cover them in your own plan. That's kind of the requirement. So the question is who is a child? You would think that the Affordable Care Act would have explained who a child is, but it didn't. Guidance that's come out has said this: a child is a son, stepdaughter, stepchild, legally adopted child, or an eligible foster child. Now keep in mind that in your health plans, if you get an insured plan, it may include other children, depending on your health plan. For instance, it may say anybody placed within the employee's care by court order would not necessarily be a foster child, but that child would be eligible for coverage. Some plans may actually include grandchildren or other children. Okay? The thing to keep in mind is, for purposes of this age 26 requirement, the mandate does not extend to other children an employer may cover, such as a grandchild, a niece, or a nephew, which means this: if you can control the eligibility requirements under your plan, which most of you with insured plans probably cannot do very easily, you can say any children that are a grandchild, a niece or a nephew are not eligible to continue on your plan until age 26, and they will be subject to the old rules you used to have, which was what? The coverage to age 18, but maybe to 21 or 23 if they were enrolled in school. So you need to take a look at that. For those of you who have self-funded plans, that is something that you can put into your self-funded plan. And if you want to, that is something you can do to control the costs a little bit. I have heard that adding coverage for children to age 26 has become pretty expensive for the insurance companies. It's expensive enough that it's actually increasing premiums. So that's something to keep in mind, yes.
Do you know why they even made the age 26 rule?
I have no idea why they came with the age 26 rule, but I'll be honest with you, the way I think that most of these laws occur is that somebody somewhere, maybe a relative, one of the legislators or something, had a family member that had a health condition, and they kicked them off. They kicked the child off of coverage before they, hit 26, and they thought that's not right. We should have kept the child on coverage to continue to get health coverage. I mean, that's how these rules occur. Usually, there's some special interest that causes it to occur. But that's a great question. I have never heard that question before. I have no idea.
I mean, it just seems quite
Yeah.
25-year-old staffer for
Yeah. You're probably right. That could have been too. I mean, we have no idea.
Who pays for it if the parent doesn't want to pay their portion of the premium?
Okay. Good question. If the parent doesn't want to pay their portion of the premium, the parent is not required to enroll their children to age 26. For instance, if it's only employee and spouse, and they're only a two-party rate, and they don't want to increase their contribution rate to a family rate, they don't have to cover any children. The employer has to make it available to them if they do want to cover the children. So it really is the choice of the employee as to whether or not they cover the children, the adult children, and pay the additional contribution.
So if they don't want to, and the child comes in and says they want to be covered?
If the child comes in and wants to be covered, that's not the child's option because it's the employee's plan.
So the parents can say no?
The parents can say no. They're the ones that are going to make the coverage decisions under the plan. Good question.
Thank you.
Oh.
The thing was about the independent child, is it the employer's responsibility to determine whether that child is a dependent child?
Well,
I mean, you can know that somebody has a child that's 25 or 6, but how do we know if they're, quote, a dependent?
right. Well, the thing,
They could be married.
the thing, yeah, that's the point of this law is that the employer cannot look at issues of whether or not the child's a dependent or the child's married or anything else. You must offer coverage to the child regardless of them being married.
Right there says that they're required to cover dependent children.
Well, that's what it's called, okay? The child doesn't have to be a tax dependent or any other, even be living in the home anymore, but that's what it's called. Okay, it's really, and they also call it adult child coverage, but it also applies to all children from birth to age 26. But they called it the adult child or adult dependent child coverage. I think they probably introduce us to exactly what the requirement was. But you're right, the child does not have to be a dependent. In fact, the employer cannot say that we're going to look at whether the child's dependency. Good comment. Yes?
A grandparent has custody of a grandchild and is raising the grandchild as the grandchild.
Okay, good question. If the employee is a grandparent and has the grandchild and actually has custody of the child, the question is has the employee been given legal guardianship, okay, by the court? And if that is covered by the plan, by the insured plan, yes, that child is eligible to be enrolled, and it's very likely the insurance company is going to treat that child as the same as any other child under this particular law, cover that child to age 26. But if that child was not subject to an order by the court or anything like that, then the child would not have the rights to be covered at age 26. But once again, for those of you with insured plans, you're going to be operating under the rules of that insurance policy. And Dina and Callie, you'd probably know better than I would. Are there insurance policies out there available now that you've seen that do not strictly apply this particular law, that do say that it's only going to apply to these children?
No, I mean, they're all pretty much
They're all
falling
doing,
in line.
right, regardless. And
Yeah.
so almost every plan that I've seen is going to say, if it's a grandchild and there's been this court order awarding custody or guardianship of the child to the employee, then yes, that child's eligible for coverage, and we're going to cover that child to age 26. Yeah. That's kind of the way these things
Carrier's
tend to
gonna
roll.
err on the side of taking care of the member and the dependent. and
Right. That,
getting them
did you hear
coverage.
Dina's comment? The carrier's going to not take a chance, is going to err on the side of the employee and the child. See, they're not going to risk denying coverage and then find out that, hey, what they did was wrong. Okay. A foster child is a child placed with an employee by an authorized placement agency or by a court judgment, decree, or order. And what the regulations have said is that you, as an employer, have the right to say, okay, I want to see a copy of that court order before we allow this foster child to be covered under the plan. Okay? And that, I assume, would be regardless of what your policy says. Okay? You have the right to determine if this is a bona fide foster child who has been placed with the employee by court order. The following coverage is also tax-exempt coverage for children to age 26. That meaning that under the old rules, if you covered a child who was not a tax dependent, the employee was taxed on the fair market value of that child's coverage because it was no longer tax-free under the old laws, but it is now tax-free under the current laws. And if the employee has a health FSA or an HRA, that plan may reimburse the employee for the expenses of the child through the year in which the child remains 26. Okay, so there are some benefits for the employee that run directly from this law. Annual limits. Annual limits on essential health benefits for grandfathered and non-grandfathered health plans are now going to be fully applied beginning in 2014. Up till now, we've had restricted annual limits for essential health benefits, meaning this: if you had essential health benefits in your plan, and that's a list of benefits we'll be talking about, the employer's plan could say there's going to be an annual limit up to X number of dollars. That's going to be totally eliminated beginning in 2014. No annual limits, no lifetime limits under any plan. That's going to increase the cost of premiums to you. Annual limit prohibitions do not apply to health FSAs and what they call limited scope dental and vision plans. Those are those plans that you purchase separately from your health plan or arrange for separately from the health plan, or you can buy from the same carrier as your health plan, but which you give your employees the option of enrolling in dental coverage or the option of enrolling in vision coverage. Those are limited scope dental and vision plans. Or it doesn't apply to grandfathered individual plans. These are ones which individuals who are not getting employer coverage go down to the insurance company and buy the plan. Or they do not apply to health reimbursement arrangements, and we're not going to go there. I think Dina said none of you have health reimbursement arrangements that you know. Just a few of you. But not probably enough that we want to spend time on that. Okay. Summary of benefits and coverage. The only reason I'm including this here is that I want you to be aware of some of the distribution requirements so that you will make sure that they are being taken care of. Now, working with Dina and her staff, you're going to see that this is being complied with, right? Yes. But just be aware of this. An SBC, like I had mentioned earlier, is a document that you must provide to your employees. The insurance companies must also provide one to you as employers, but you must in turn provide it to your employees, and it basically informs the employee of all of the fundamental elements of the health coverage. The purpose is to enable them to compare to other coverage that they may have available to them, such as if they go into an exchange, they may want to compare it to coverage that's available through the exchange and see which one looks best for them, which one has the best price, everything else. And that's the reason for the SBCs. Now, when must you provide an SBC to employees? For new enrollment, you must give one with any written application materials, or if you don't have any written application materials, no later than the first date of eligibility to enroll. Okay? If you have open enrollment, it must be given with the open enrollment materials. Once again, if you require the employee to sign new enrollment materials every year, or if they are automatically enrolled for the following year, the SPC must be provided at least 30 days prior to the new plan year, or if the policy is not final, as soon as practicable, because you don't always have the finalized policy in place at the time that this occurs. The SPC is only required for the plan in which the participant is enrolled for open enrollment. HIPAA special enrollees. Under HIPAA, there are times when an employee is allowed to come into the plan in the middle of the year, such as if they have a new child, or they get married, they can add the spouse, reasons like that, or they lose other coverage. In those situations, you must give the SPC to HIPAA special enrollees the first plan year after September 23rd of 2013, and must be provided within 90 days after they actually enroll in the plan, which is kind of silly to me, because the purpose of an SPC is to give them some coverage choices. But here you only have to give it 90 days after enrollment. If requested, you must provide it as soon as possible, but it must not be any later than 7 days after the request. I just wanted you to be aware of this. The insurance companies are going to be taking care of this for most of you with insured plans. For those of you with self-funded plans, your third-party administrator will probably be taking care of it for you, but you must make sure that's going on, because the ones that ultimately responsible for this particular requirement is you, the employer, and you're the one that's going to be penalized if you don't give the SPC when due. Notice of coverage offers through the exchange. All this says is this: you're going to have to give a notice to employees that explains what their coverage options are through the exchange. Basically, some of the fundamentals of how these state exchanges are going to work. Right now, this particular requirement has been delayed, but you're going to have to give it probably by October 1st, and we're looking for a standard or sample notice to be provided by the federal regulators, so that it's going to be basically provided for you. Now, this is going to be one more notice that you have to include in your employees' open enrollment packets or new employee packets, in addition to those other notices that you have to give, such as the COBRA notices if you're a COBRA employer, or the Women's Health and Cancer Rights Act notice, or the Newborns and Mothers and Health Protection notices. So once again, this is just going to be another notice, but right now you don't have to give this notice. We're going to get word from the federal government when this notice requirement takes place, when you have to start giving it. This particular requirement is another requirement that the insurance companies have told us is going to impact your premiums. For small employer groups, the annual deductibles that you have in your plan cannot exceed $2,000 for the self-only coverage and $4,000 for non-self-only coverage, meaning two-part of your family coverage. The annual deductible limit may be exceeded if necessary to reach an actuarial level of coverage. This is kind of interesting because as the insurance companies are working under these restrictions of limited deductibles that they can have in the plan, they are finding that they cannot provide coverage under the plans and meet some of these actuarial requirements that we'll be talking about in just a few moments. So they've actually already had to exceed these particular prohibitions or restricted annual limits just to get to a certain value of the coverage. And I'll talk about that. Once again, it's another concept that's difficult and really not necessary for you to understand or to take out of here, but I think it's necessary for you to at least hear, to know that this is going to be a reason that, unfortunately, you're going to be presented with substantial premium increases for next year. Large group insured plans and self-funded plans are not currently subject to this deductible limitation. And then it's really neat, they put in this little caveat, at least until regulations are issued, okay? Which means that everybody's going to be hit with these particular requirements. Yes?
So, is that starting in 2014?
Right.
So they're saying the deductibles on small coverage can't be more than $2,000?
2,000 itself, only 4,000 for family. Right. But that being said, remember I just said that they can go beyond those deductibles if necessary to reach a certain actuarial value in the plan. And that's what we're already looking at. Yeah, so I don't know, it seems like kind of a silly requirement when they say this is a requirement, but you can go beyond it, and then it's absolutely necessary. And we're talking about significant amounts beyond that, is from what I've been hearing. Have you heard anything about that? Yeah.
It just in the last several weeks,
Mhm.
they've been tweaking that and
Uh-huh.
different interpretations,
Right.
which is what makes this so hard. So, don't hang your hat on that
Right.
particular rule, because it is gonna probably change.
I think that's probably the best thing that could be said here, Dina, is that you're absolutely right, and it may be necessary to compare policies to see where you're at in the policies, but keep in mind that the lower, the greater those deductible restrictions are on a plan, the higher your premium is going to be, okay? Because what it is doing, it is limiting cost sharing with your employees and putting more the burden of paying benefits on the insurance company. And that's the reason why it's causing increases. Okay, there's also a maximum on out-of-pocket maximums that are in a health plan, and this will apply to all health plans, small employer, large employer, self-funded plans. And what this says is that for that out-of-pocket maximum, that is a limit that the insurance policy set on, saying that you will not be required to pay more than X number of dollars until you receive full benefits under the plan. That out-of-pocket maximum is going to be related directly to the out-of-pocket maximums under a high-deductible health plan. And a high-deductible health plan are those plans that have been established for purposes of health savings accounts, meaning that individuals must be enrolled in a high-deductible health plan to be able to contribute funds to a health savings account. So that's the requirement here. This particular out-of-pocket maximum cannot be any greater than the amount under the high deductible health plans. And the reason we have to say it this way is that the amount under a high deductible health plan is going to change every year. It's indexed, which means it's going to go up with inflation. For 2013, the out-of-pocket maximums are $6,250 for self-only coverage and $12,500 for family coverage. So that's going to probably go up, and that's going to be the maximum. Safe harbor for the plan year after January 1st of 2014 for plans with multiple administrators. The plan is in compliance if neither the major medical plan nor other coverage exceed the out-of-pocket limits. What are we talking about here? What this law says is that if you have multiple benefits under your health plan, for instance, you have your medical plan and you have a prescription drug plan, and each of them has an out-of-pocket limit, the combined out-of-pocket limit cannot exceed this. But for at least 2014, what the law is saying is that for that 1 year only, if either plan satisfies this requirement, then you are not going to have to worry about violating this requirement. I think I lost a lot of you on that one. And I don't blame you, because like I warned you about when we first started, this stuff is awful. But try to keep in mind the concept, okay? Don't try to understand everything that I'm saying, because I don't know how you can take it out of here and really be well versed in it. Understand the concept, understand what's going on here, understand that this is going to impact your premiums or your expenses of your health plan. Okay. Mental Health Parity and Addiction Equity Act, the out-of-pocket maximums for mental health and substance use disorder cannot differ from the out-of-pocket maximums for medical and surgical benefits. That's what this Mental Health Parity Act says to begin with. Okay. You must provide mental health or substance use disorder benefits that are at least as equal to any of your medical surgical benefits. 90-day probationary period. Temporary guidance is that the probationary period that you have in your plan cannot exceed 90 days. So everybody looked at that and said, okay, for most of us, this should not be a problem. Now, there have always been some of you employers who may have had a 180-day probationary period, meaning that an employee had to work for you for 180 days, after which they would become eligible for coverage under your health plan if they were a full-time employee. Okay? There was a good reason for that. Generally, it was because you had the type of employee population that came in, moved out, came in, moved out, very unstable, but it was because of the industry that you were in. And if you had a shorter probationary period, it would mean that you had to enroll people and then cancel them and offer them COBRA, and then enroll them, cancel coverage, and offer COBRA. That's the reason you had a 180-day probationary period, even a 1-year probationary period. Well, the new law says it can be no longer than 90 days, but beyond that, those of you who had 90-day probationary periods usually ran it like this. You said, okay, you must work for us for 90 days, and then the first day of the month after that you have satisfied that 90-day probationary period, you'll be enrolled in the plan. This new law says, no, you don't do that any longer. You must have that person actually enrolled within the 90-day period, which means what? Basically, you can have a 60-day probationary period because you're going to have to get them enrolled by the first of the month following the 60-day probationary period to satisfy this 90-day rule. Okay? It's one more thing, and look at it this way. It adds an individual onto coverage in your plan with all their medical expenses 1 month earlier than you may have previously done it, which increases the expenses paid by your plan and increases your cost of the plan, increases premium if it's an insured plan. Not a very happy thought. Okay. I wish I could tell you good things today. Okay.
Does that, if you have a part-time employee that becomes a full-time employee, what is the 90-day? Does it start as they become full-time, or does it start when they start working?
I wish you hadn't asked that question. Did everybody hear the question? Because it's a great question. You have a part-time employee that becomes a full-time employee. You know what? We're going to get into that. And if you think that what I've been talking about now has been tough, is really tough. The short, simple answer is that you're going to have to get them enrolled generally within the 90-day period or shorter. But there are some requirements there, particularly when you have somebody who was a part-timer and went to full-time, that you are going to even have a shorter time period in which you get them enrolled. And I'll explain that when we get there. Okay.